Good morning. I'm Sue Morgan, National Director and Strategic Programme Lead for Primary and Community Care. And I'm delighted this morning to have this opportunity to talk to you and give you an overview of the strategic context for primary care and the strategic programme. So to set the strategic context, the primary care model for Wales was first described in Setting the Direction in 2010, and this was followed up by the Primary Care Plan for Wales, which ran from 2015 to 2018, and it set out a series of actions both for Welsh Government and for health boards, and included a very detailed workforce plan. This took us up until March 2018, and then in June, we received a Healthier Wales, which clearly set out the expectation to fully implement the primary care model for Wales. In response to this, the strategic programme for primary care was developed that set out the actions required to deliver this. Clusters are at the absolute heart of the primary care model for Wales, and put simply, a cluster brings together all local services involved in health and care across a geographical area, typically serving a population between 25,000 and 100,000. Working as a cluster ensures care is better coordinated to promote the well-being of individuals and communities. So what is the primary care model for Wales? It's the primary care component of place-based care. And during the period of the primary care plan from 2015 to 18, funding was provided for a pace-setter programme that funded 24 projects on a once for Wales basis. What we concluded from the learning from the pace setters was that there were 5 very clear themes that came across all of those projects. Firstly, that multi-professional teams working at cluster level was the way forward. At practice level, it is too small, but at cluster level, you start to get the economies of scale. In having a multi-professional team, you have to ensure that there are safe and effective systems to direct people to the right person or team at the point of contact. Another key theme that came through was that integrated teams ensure a holistic approach to care. So really thinking about the physical, mental and social well-being of the individual. A fourth theme was that services work well across in and out of hours to ensure seamless care. So really thinking about what that 24/7 offer is. And finally, success also depends on an informed public who have access to a range of community services. As way of background, the strategic programme for primary care is an all Wales Health Board-led programme that works in collaboration with Welsh Government and responds to Healthier Wales to deliver the primary care component to place-based care. There are 3 very clear swimming lanes for us within the programme. The first is around 6 key work streams, which were pulled together in order to really think about what actions were required. And the 6 are described on the slide as prevention and well-being, 24/7 model, data and digital technology, workforce and OD, communications and engagement, and transformation and vision for clusters. And we have a wide variety of stakeholders on each of those work streams to take forward the programme. Another area is seamless working, and what we found was actually, there can be a lot of difference in terms of the way organisations approach the strategic context, and what we wanted to do was really draw together that thread through all of those organisations in terms of the implementation of the primary care model for Wales. And then finally, the primary care contract reform. There's a significant reform programme underway, and it's actually how that works in tandem with the strategic programme for primary care. So with the requirements to fully embed the primary care model for Wales in mind, what are the key priorities of the strategic programme for 21, 22 and beyond? We have 4 clear priorities identified, which will be delivered through coordinated activities through the 6 work streams of the strategic programme for primary care. They're all grounded in care closer to home, and the priorities are identified by the Health Board Directors of Primary Care. The 4 priorities are mental well-being, community infrastructure, urgent primary care and accelerated cluster development, and I'll go through these each in turn. Mental well-being was a priority for us before the pandemic, but has come into sharper focus with all that has been brought with the pandemic. Really thinking about that Tier 0-1 offer at a cluster level and equipping our frontline staff to ensure they are able to signpost is absolutely uppermost in our minds, and we're working very closely with NHS Wales Mental Health Services. There are 4 clear products we want to deliver through this. The first being to map Tier 0, Tier 1 mental wellbeing services on a cluster footprint. The second is to develop a compendium of these services across Wales. And then third is around a toolkit of resources to support clusters and partners to increase the breadth and range of these services. And finally, to identify exemplar approaches to shared care models. So turning to our second priority, community infrastructure. Across Wales, each health board, local authority and regional partnership board area has, over time, developed a historical community service offer in response to the challenges that they face within their specific health and care system. As such, community services are very wide-ranging, covering a number of agencies and a whole raft of services. Working with the delivery unit and the NCCU, the strategic programme will aim to set out the fundamental requirements of an integrated 24/7 multi-professional place-based model of care and really focus on consistency, reduce variation and build on good practice. A few of the key products include a demand and capacity tool, a framework for multi-professional working, including virtual wards, and a suite of outcome measures. Our third priority is around urgent primary care, and primary care delivers urgent care at high volume. As part of the work programme for the 24/7 work stream for 2021, urgent primary care pathfinders were implemented for the winter period in order to increase capacity and test different models. These covered a population of over 1.5 million, that covered 234 practices and 38 clusters, and it saw over 14,000 patients, with the cost per patient ranging between £32 and £35. As a consequence, a delivery matrix and a minimum data set has been developed alongside a definition of primary care, and we're really working to develop that into what is the model for urgent primary care in Wales. Academic colleagues indicate that this is groundbreaking work, both at UK and at international level. And the learning was shared at a virtual national event in October 2021, attended by over 150 stakeholders. Turning to phase 2, we do have funding secured and we're looking to expand the rollout of urgent primary care centres across Wales. Learning from the pandemic and how optometry, pharmacy and dental services responded will be built into the evaluation of the Pathfinder models and will inform an urgent care delivery model for services in primary care to meet the varied needs of the population. This will be supported by a clear operational plan for rollout of the service on a sustainable basis that links with 111 and the wider urgent care offer. And finally, the fourth priority is accelerated cluster development. And this is absolutely key to those three priorities I just talked about, to fully embed in the primary care model for Wales and really being able to provide care closer to home. Accelerated cluster development is about organising primary care to support delivery of place-based care and enable a focus on population health and well-being. The presentations that follow will give you more detail on it, but as we will hear later, there is really an appetite from primary care, from stakeholders, NHS leadership and Welsh Government leadership to accelerate cluster development. And on that final note, I'd like to thank you all for listening this morning. And should you want to find out more about the strategic programme, my final slide can give you all the contact details. Thank you very much.